Hello, my name is Lindsay Fahey, and I'm going to be sharing my presentation on the high and rising costs of prescription medications. I have done extensive research and have conducted interviews with many individuals who are experts on this topic, and during this presentation, I will be sharing with you what I have learned throughout this process. To start off, I'd like to talk about what exactly is a prescription medication. A prescription medication is a pharmaceutical drug that legally requires a medical prescription to be dispensed. Explaining the problem. On this slide, I'd like to talk a little bit more in depth about what the issue is that I've been covering this past semester. Prescription medication costs are overpriced and the prices are rising every year. If you live in the United States, you know that the high cost of prescription medications is one of the largest issues we face as a country today. The reason why this issue is so pressing in our country is because it affects not only people's lives, but their health and their ability to survive. Individuals with conditions who require medicinal treatment are being forced to pay out of pocket for what their insurance doesn't cover. This means that people who have insurance, where some people don't have insurance, are having to pay hundreds to thousands of dollars for medicines that they require in order to maintain their conditions, some of which they cannot control, such as type 1 diabetes. Some people are suffering from medical issues due to not being able to afford and obtain their prescription medications. A lot of patients that we see in the hospitals are showing up due to uncontrolled blood sugars, high cholesterol levels, and things like that, due to the fact that they cannot afford the medications that can control these conditions. And they end up in the hospital, which therefore raises their medical costs even higher than they were before. The biggest issue is that pharmaceutical companies can raise these medication costs every year, because currently there are little to no policies put in place to stop it. Later on in this presentation, I'll explain to you what policies have been presented and what can be done in order to help these people afford their medications. Why I chose this topic. I'm a nursing student at Queens and witnessed this issue affect many people during my time in the hospital. I believe it is unfair that these individuals, some of whom have conditions they could not prevent, are having to pay such high prices for something that could save their life. Pharmaceutical companies have free rein over the prices of these medications and have no consideration for the populations they are putting at risk. For example, there are medications such as insulin that help control type 1 and type 2 diabetes, and if not taken, can cause death or serious medical issues to these people, as well as EpiPens, which are used for people who are allergic to different things in case they have an anaphylactic reaction, which means they have an allergic reaction and their throat can begin to close up, and they'll need epinephrine out of their EpiPen in order to help save their life. However, the cost of these EpiPens and this insulin has raised significantly over the past 10 to 20 years. On this slide, I'm just showing the chart of the rising cost of insulin from July of 1996 to July of 2016. Novolog and Humalog are popular brand names of insulin, which are used to treat type 1 and type 2 diabetes. This chart shows that from July of 1996 to July of 2016, just 20 years, the cost has risen from less than $50 to over $200. Throughout my research, I've become familiar with the term known as price gouging. Price gouging is a term referring to when a seller spikes the prices of goods, services, or commodities to a level much higher than is considered reasonable or fair, and is considered exploitative, potentially to an unethical extent. Throughout my research, I've also become familiar with a policy known as the Anti-Price Gouging Law. There have been many attempts made by multiple states to pass the Anti-Price Gouging Law. This would make it so that state attorneys can stop pharmaceutical companies from raising the cost of medications annually for the benefit of their companies. This policy was proposed but unsuccessful in states such as Maryland due to a 2-to-1 rule. In researching ways to help people better be able to afford their medications, I came across a service called GoodRx, which was recommended by a pharmacist who I talked to during my interview portion of this project. GoodRx is a company that tracks prescription drug prices and offers drug coupons in the United States. The pharmacist informed me that this is a way that can help individuals afford their prescription medications through a free app on their phone. GoodRx checks more than 75,000 pharmacies in the United States and can find more affordable options for people who require prescription medications. The website gets about 14 million visitors a month, which just goes to show how many people in the United States are dealing with the issues of unaffordable medications. This slide shows the comparison of retail prices compared to GoodRx prices. The prescription medications listed to the left are popular and commonly used medications. The price in the third column shows what retail price is, and the fourth yellow column shows the highly discounted price through GoodRx. This is a great option for many people who can't afford their medications but may not have insurance either. Some local recommendations I'd like to discuss regarding this issue involve the use of GoodRx, the implementation of different policies, and the promotion of a healthier lifestyle. As explained on the last slide, GoodRx is a service that can help patients better afford their medications. As a nursing student, I had never heard of GoodRx before hearing it from the pharmacist I interviewed during this project. A local recommendation would be to advocate the use of GoodRx more often for all patients who need a prescription medication. I'm sure there are many people who require prescription medications that do not know of this service, and it is a free app, so it would be a great way for them to be able to afford their medications without having to obtain insurance. The second recommendation I'd like to talk about is to propose implementations of policies such as price gouging prohibitions, transparency laws, and the regulation of pharmacy benefit managers to local lawmakers who can pass suggestions to state-level lawmakers. The transparency law makes it so that the processes of drug manufacturing and distribution are made accessible to policymakers as well as consumers in the United States. Pharmaceutical companies are currently the only ones with access to the drug manufacturing and distribution processes, which leaves us, the consumers, and policymakers in the dark. The role of PBMs, or pharmacy benefit managers, is to negotiate rates of cost of prescription medications in the United States, as well as playing a large role in the process of distribution. The regulation of PBMs would prevent the inconsistency of the pharmaceutical spending goals, which therefore would decrease the cost of prescription medications each year. The third recommendation I'd like to discuss is the promotion of a healthier lifestyle and suggestion of screenings to everyone to help prevent the need for prescription medications. Now, this is the last recommendation I'd like to talk about because it's not my best option. However, if the change cannot come from a government level, the best step to take is to promote a healthier lifestyle for individuals who can prevent certain illnesses and diseases and reduce the need to get prescription drugs in the first place. When it comes to unaffordable prescription medications, this issue is not only at a local level, but also a global level due to the importation of many prescription medications. Some global recommendations I'd like to discuss involve how the United States differs from other countries because we can negotiate drug costs based on the market, not the consumer, whereas other countries negotiate directly with the pharmaceutical companies for the benefit of those taking these medications. In the United States, only private insurers can negotiate, not different programs such as Medicare and Medicaid. Another recommendation would be to ask government officials and pharmaceutical companies for transparency to the public on the research, funding, and development they claim the revenue helps support. Without transparency laws, us, the consumers, and policymakers have no way of knowing where the money towards prescription medications is going. Thirdly, I'd like to talk about the emphasization of the importance of the anti-price gouging laws as well as transparency laws and the regulation of pharmacy benefit managers. Through the implementation of these policies, we can work to help lower the cost of prescription medications for American citizens. Thank you.